Clomid, Clomiphene, uses, dosage, side effects, and safety information. Clomid is an oral fertility drug, Clomiphene Citrate, that promotes ovulation by increasing the release of key reproductive hormones. It's typically offered as a first-line treatment before more complex and costly interventions like IVF, making it a more accessible option for many couples. By helping regulate or trigger ovulation, Clomid improves the likelihood of conception, particularly in women whose menstrual cycles are irregular. Its cost-effectiveness and non-invasive administration have made it a cornerstone in managing infertility, especially for those with conditions like polycystic ovarian syndrome, PCOS. What is Clomid? Clomid, also known as Clomiphene Citrate, is an oral medication primarily used to treat infertility in women. It is often prescribed before more invasive treatments such as IVF, in vitro fertilization. Clomid works by stimulating the release of hormones necessary for ovulation. What are the benefits and uses of Clomid, Clomiphene Citrate? Clomid helps jumpstart or regulate ovulation by influencing the body's hormonal feedback loop. Conditions Clomid treats: anovulation or oligoovulation, women who do not ovulate regularly, e.g., those with polycystic ovarian syndrome or other ovulation disorders, often take Clomid to stimulate follicle development. Infertility associated with PCOS, Clomid is particularly beneficial for women with PCOS who want to conceive, since it can trigger the hormonal cascade leading to ovulation. Male hypogonadism, Clomid men, off-label, Clomid may be used in men to raise luteinizing hormone, LH, and follicle-stimulating hormone, FSH, levels, thereby encouraging testosterone production and improving sperm count. Secondary uses of Clomid: occasionally used to correct irregular menstrual cycles in women not actively trying to conceive. Some clinicians use Clomid as a component of mild ovarian stimulation protocols for couples undergoing intrauterine insemination, IUI. Research has explored Clomid for male pattern infertility and certain rare pituitary-mediated disorders. How Clomid works: Clomid works by tricking the body into sensing lower than normal estrogen levels. As a result, the pituitary gland is prompted to release higher amounts of two key hormones. Follicle-stimulating hormone, FSH, stimulates the ovaries to develop one or more follicles, each containing an egg. Luteinizing hormone, LH, triggers the release of the mature egg, ovulation, from the follicle. Because Clomid effectively blocks estrogen receptors in the hypothalamus, the brain believes estrogen is low and ramps up FSH and LH production. Increased FSH and LH lead to follicular growth and ovulation, which are key for conception. Signs Clomid is working: mid-cycle ultrasound findings, development of one or more ovarian follicles. Serum hormone changes, elevated LH surge followed by a rise in progesterone, indicating ovulation. Symptomatic clues: mild lower abdominal cramping or the appearance of cervical mucus consistent with ovulation. Clomid dosage. Clomid dosage for twins or multiple ovulations varies by patient response, but typically doctors start with a standard dose. Below is a general guideline: always follow your physician's advice. Clomid is usually prescribed as a Clomid 50 tablet, Clomiphene Citrate 50 mg, taken orally once daily for 5 consecutive days, beginning on day 3, 4, or 5 of a woman's menstrual cycle. Dosage adjustments may be made in subsequent cycles if ovulation does not occur or if multiple follicles are desired, e.g., Clomid dosage for twins. Typical dosage instructions, as per doctor's advice. Starting dose: Clomid 50 mg, 1 Clomid tablet, daily for 5 days, often cycle days 3 to 7. Dose escalation: if no ovulation is observed, the dose may be increased to 100 mg, 2 tablets, daily in the next cycle. Rarely is more than 150 mg used. Clomid dosage for twins: some specialists may prescribe slightly higher doses, e.g., 100 mg, to encourage development of more than one follicle, increasing the chance of twins. However, higher doses also increase the risk of ovarian hyperstimulation and multiples. Clomid men. Men typically receive 25 to 50 mg every other day, monitored by hormone levels. What should I do if I miss a dose of Clomid? If you miss a dose, Take it as soon as you remember unless it is almost time for your next dose. Never double up, do not take 2 tablets at once, to make up for a missed dose. Continue the rest of your cycle as instructed by your doctor. What happens if an overdose occurs? Symptoms of overdose may include severe abdominal pain, due to excessive ovarian stimulation, visual disturbances, blurring, spots, or floaters, dizziness, headache, and nausea. What to avoid: do not take more than the prescribed dose of Clomid tablet, avoid self-adjusting the dose without consulting your healthcare provider. Seek medical attention if you suspect an overdose or experience unusual symptoms. What are the side effects of Clomid? Like all medications, Clomid can cause side effects, ranging from common mild discomforts to rare but serious complications. While generally considered safe for use, Clomid can induce a range of side effects, most of which are mild and transient. However, certain serious but rare adverse events necessitate immediate medical attention. Common side effects: ovarian enlargement, vasomotor flushes, hot flashes, abdominal pelvic discomfort, nausea, vomiting, visual symptoms, blurring or other visual disturbances, headache, abnormal uterine bleeding, intermenstrual spotting, menorrhagia. Serious side effects: allergic reactions, rare but possible, ovarian hyperstimulation syndrome, OHSS, in some cases of excessive follicular development. Advice to users: patients should immediately contact their doctor if they experience any serious side effects, or if common side effects become severe or persistent. Precautions and warnings. Before starting Clomid, it's crucial to understand who should avoid this medication and what lifestyle adjustments are recommended. Who should avoid this medicine? Pregnant women. Clomid is contraindicated during pregnancy because it can harm a developing fetus. Liver disease or cysts. Women with untreated liver disease, ovarian cysts, unrelated to PCOS, or abnormal uterine bleeding should not take Clomid. Pituitary or ovarian failure. If the root cause of infertility is primary ovarian failure or pituitary insufficiency, Clomid is unlikely to work. Allergy to clomiphene citrate tablets. Any history of allergic reaction to clomiphene or related compounds. Conditions where caution is needed. Thyroid or adrenal dysfunction. Ensure these are managed before beginning Clomid. Endometriosis. Use Clomid under close supervision, as estrogen fluctuations may exacerbate pain. Epilepsy. Clomid can lower seizure threshold. Adjust anti-seizure medication accordingly. Are there any age restrictions? Generally prescribed to women of reproductive age, 18 to 40. Use in adolescence is uncommon and only under specialist guidance. Women over 40 may have reduced efficacy and higher risk of side effects. Fertility evaluation is crucial. Alcohol or food interactions. No direct contraindications with most foods, but alcohol should be consumed in moderation. Excessive alcohol can interfere with hormonal regulation and ovulation. Maintain a balanced diet rich in nutrients, folate, iron, calcium. Avoid high doses of caffeine and processed foods, as they can affect fertility. Things to do or avoid while taking Clomid. Do: maintain scheduled checkups and ultrasound monitoring to track follicle growth. Stay well hydrated, rest after ovulation to optimize implantation chances, and follow supplementation advice, e.g., folic acid. Avoid smoking, illicit drugs, and excessive heavy lifting or strenuous exercise around ovulation. Do not self-adjust dosage. Minimize stress as much as possible to support hormonal balance. Possible interactions with other medications. Drug interactions. Clomid can interact with certain drugs, herbal supplements, or over-the-counter products. Antidepressants, SSRIs/SNRIs, may alter Clomid's effectiveness by affecting hormonal feedback loops. Thyroid medications. Uncontrolled thyroid levels can blunt Clomid's effect. Ensure euthyroid status. Anticonvulsants. Some anti-seizure medications may lower Clomid plasma concentration, reducing efficacy. Supplements and herbal products. Street John's wort, may reduce Clomid effectiveness by inducing liver enzymes. High-dose vitamin A and E supplements. Excessive vitamin A could interfere with hormone receptor binding. Herbal fertility supplements. Always discuss with your doctor. Some may contain phytoestrogens that compete with Clomid. Inform your healthcare provider about all prescription medications, over-the-counter drugs, and herbal supplements prior to starting Clomid. How should Clomid be stored? Proper storage helps maintain Clomid's potency and safety. Store Clomid tablets, Clomiphene Citrate tablets, at room temperature between 20 degrees Celsius and 25 degrees Celsius, 68 degrees Fahrenheit to 77 degrees Fahrenheit, away from direct light, heat, and moisture. What happens if Clomid is not stored properly? Degradation. Exposure to high heat or humidity can cause tablets to break down, reducing effectiveness. Contamination. Improper storage near moisture, e.g., bathroom, may lead to mold or contamination. Child access. Always keep Clomid away from children. A child accidentally ingesting Clomiphene Citrate 50 mg could suffer hormonal imbalances or nausea. Keep away from children. Store on a high shelf or locked cabinet. Direct sunlight. Prolonged exposure may degrade active ingredients. Moisture. Avoid storing in bathrooms,